I've had two other webinars. The first one was not so good. Last week, I think, was pretty factual, but this webinar, I can talk to you about stuff that I couldn't talk to you beforehand. There's a blackout period that honest and ethical agents are required to follow, which says you can't talk about 2026 plans or specific information until October 1st, which was a couple of days ago. Now, I want to talk to you about some things that are different for this year. One of which is I am no longer allowed to receive or to ask for prescription or doctor information by emails or text because there's so many cybersecurity threats. It's a threat to your personal identity and HIPAA information. So what I have is a secure and encrypted link that you can enter your doctor information if you want to, or if you have or are interested in a Medicare Advantage plan. But you need to enter at least your prescription your prescription information, the name, dosage, and frequency, because there are so many changes in Part D drug coverage. And I'll explain why and what's happening there. Also, Medicare.gov member portal review. I highly encourage you to go to Medicare.gov and log in or register if you've never been there before, so that come October 15th, which is the very first day of open enrollment, you'll be able to navigate to Medicare.gov. And if it's required, you can change, or if there is, I don't want to use the word better, but let's say there is a prescription drug plan, a standalone prescription drug plan that has, that will mean lower costs for you based on your medications that you provide. You're going to receive the recommendations and plan comparisons by email before open enrollment starts, God willing, and there's hundreds of them to complete. And by going through Medicare.gov and enrolling, you're going to get a recording as to how to do that. But man, it is super simple. The hard part is if you have to go through there and enter all your prescriptions and prescription information and navigate through it. All you'll have to do is basically click on the insurance company and the plan and enroll in the plan that you've already seen is going to be the lowest total cost for your current prescription plans. We'll go through this again next year. Now, when I say plan comparisons and recommendations, standalone Part D drug plans recommendations are what you have if you have a Medicare supplement plan. There are even more changes, which I'll get into for those of you that have Medicare Advantage plans. If you have a Medicare Supplement Plan F, which means you were born on or before 1954, or Plan G, which most people born in 54 or later have, there are some options that could save you premium and they will have additional risk, but it would reduce your expenses. Do you want to do that? Well, it depends on your health because you do have to answer medical questions. Okay, and you would not, if you have expensive or, pardon me 1 second. Yes, Cloud. Yeah. Okay, all right. I've got 5 people waiting to get in this, so I'm going to admit all. All right, thank you. All right. So everybody is in here. And I'm going to go back to the webinar. I'm going to make them Claudia and Wiley co-presenters in a minute here. If you know, every year Medicare supplement plans go up in premium. And at some point, those premiums, especially as you get into your late 70s and 80s, they become expensive. Why? Because you have more claims. If you're a guy, you're going to have more claims than a lady. But there are some options for you if you are healthy, and that is a high deductible Plan G, which I'll mention, and plus a hospital confinement plan. Plan and Medicare supplement is competitive depending upon where you live. A Medicare Advantage plan coupled with a hospital confinement. I want anybody that is considering that to know what the options and risks are there. And give me a second. Okay, Medicare supplement. Here's what's changing. Not very much. There is no coverage changes. The Part B deductible that a Plan G is responsible for won't be announced until November. This year, it's, I don't know, $260 or thereabouts. It will go up. It should be somewhere maybe $280, $290, $300. We're not going to know until November. You can expect higher premium increases for Medicare supplements this year. First of all, we have higher healthcare inflation. It's at least 10% this year. And part of that is due to more claims because of the aftermath of COVID. Nobody had any wellness stuff and never went to the doctor during the COVID dark years, but it's caught up. And so you can expect higher claims. And of course, we're all getting older, especially us guys. In most states, and I'll mention that, you must answer medical questions to change Medicare supplement plans. One option, which is a pretty good option, is a Plan G Medicare supplement plan. It has a $2,870 deductible. You can add a very low cost hospital confinement plan that would reduce claims from major expenses for inpatient or outpatient surgery, hospital confinement, et cetera. The advantage of a Medicare supplement plan is you can see any doctor and hospital in the country. But again, you can only make a change if you're healthy, and you can make that change 24/7, 365 days. You do have to pass underwriting, but that is something you could do later in the year or next year. So I just want to plant that seed for you. Now, with a Medicare supplement plan, you would marry that with a standalone Part D prescription drug plan. And there are a reduction in the number of available plans for next year. There is a maximum that you will spend for medications that are in a plan's formulary of $2,100. And then the next year, the Part D or prescription drug deductible for these plans is $615 for anything but the cheapest generics. So, one of the things that I'll do in the recommendations will be to suggest you consider purchasing prescriptions that could be cheaper through other means, whether that's GoodRx, Amazon Prime, or even through Canadian Pharmacy. Why is this a change? A few years ago, there was no limit to the amount of prescription expenses somebody could have. The Inflation Reduction Act changed that. More of the meds, though, more of the cost of the medications going from unlimited to $2,100 maximum has been passed on to the Part D insurance companies. Now, this year, because of all this, there are a ton of changes in which medications are covered in each formulary and which tier medications that you're taking may be in a higher tier, which means you'll pay more if you don't change. There can also be changes to preferred pharmacies and mail order pharmacies for plans from one to the other. So I want you to just know that, and have gotten many emails from people, hey, I'm happy with my coverage. I don't think I'll need to do anything. And I tried to reply to everybody that don't assume you're going to be happy with it. Do yourself a favor and complete the secure form for the complimentary Part D drug plan review. Now let's talk about the other option besides the Medicare supplement and Medicare Advantage plan. These are private between a Medicare supplement and standalone Part D plan. The other option is a Medicare Advantage plan. These are private funds. George W. Bush was president when these were first approved. These are private plans that receive so much money from Uncle Sam for each Medicare recipient on a Medicare Advantage plan. And it is the ultimate carrot and stick. Uncle Sam provides a fixed amount of dollars through which a Medicare Advantage plan company has to manage the claims and cover their overhead and profit. The providers and also the insurance companies are required to reduce their cost and improve their quality score to earn more money. So and unfortunately, the insurance companies have figured out through machine learning and AI how to game the system. So I'm not going to get into the politics with that, but it is what it is. Medicare Advantage plans come in different shapes and sizes. Most people have a Medicare Advantage plan with prescription drug coverage. Those, especially veterans, may have a Medicare Advantage plan with no drug coverage because they get their meds very affordably from the VA. The big difference is that you have a network with a Medicare Advantage plan that you don't have within a Medicare supplement plan. There are about 90% of the plans are HMO plans, which require referral. And then there are PPO plans, which have much higher out-of-pocket maximums. But I got to tell you, the PPO plans are being phased out over the next couple of years. And this is it's just it's a circle of life. So I'm going to talk about that in a way that is compliant, but also to give you some thoughts when we do talk. Those of you on Medicare Advantage plans, that we do talk, so that you're not only thinking about, is my dental vision or my hearing benefit going up or down, but also thinking, what do you need to do to make sure that you are aligned properly and can navigate, because there will be further changes in 27 and 28. There are also specific Medicare Advantage plans that the insurance companies, any member for these, they get compensated a higher rate for managing pre-existing conditions. And most of these plans have to do with diabetes and heart circulatory conditions. Then there are Medicaid plans for people with special needs, when Medicaid is a state-funded plan, and that state-funded, federal funding for state plans is being reduced. Now, sorry for too many words on one slide. Here's a macro look. You've got aging baby boomers, so we're all getting older, more claims, more demands on providers, doctors, and hospitals. You've got 11,000 plus aging into Medicare every day. And then you have the other thing that's happening is a migration to major metro areas like Atlanta and Dallas-Fort Worth, Austin, Houston. They continue to grow. And at the same time, Medicaid funding hospitals, Medicaid funding reductions, and reduction in patients, and inability to recruit specialists are damaging rural and county hospitals. There's estimated to be 300 that will end up shuttering their doors this year. At the same time, I've got a brother in Cleveland who is an OB-GYN. Is awesome. One of his sons is now an OB-GYN, oncologist OB-GYN in Cleveland, Ohio. My brother is a year younger than me. He's now working part-time and will next year retire fully, and his wife is a nurse. That's happening more and more, especially with baby boomers and specialists. You also, and Dallas-Fort Worth is a perfect example of this, more hospital health systems are rejecting contract renewals with insurance companies. For example, UT Southwestern and Texas Health Resource and Methodist in this market, they have gone through one contract battle after another with all of the major companies. MD Anderson in Houston does not accept any Medicare Advantage plans except one that is located in Houston. Baylor, again, a contract dispute with Humana, no longer in network next year. And so you have to consider aligning yourself with doctors that are, and specialists especially, that are within a particular system, because this isn't going to change. If anything, it'll accelerate. You also, as a result of this, insurance companies and also providers have set up clinics. And this is very similar to the model in Central and South America, where you have clinics that can provide maybe very technically oriented, but they also, everybody within their system sees everything that's going on, but it also limits access to doctors and nurses to higher cost providers. Some of the most well-known ones are WellMed and Optum, which are pretty much controlled by United Healthcare, Oak Street, Village, MD, Savita here in town, Centerwell, and then you have some hospital health systems that have their own health plans as alternatives to this. An example is Baylor Scott and White in Dallas. And also in Central Texas and Austin, they have their own health plan. So they have aligned their network with their hospital system. Those of you that Parkland's one of the top hospitals in the world for burn patients and for maternity, but it's primarily known as a community hospital for those who are Medicaid eligible, and they have their own health plan. MD Anderson, I mentioned them earlier, they only contract with Kelsey Seibold, and it's the only Medicare Advantage plan, but if you're living outside of the Houston area, it's not going to help you. Now, here's who owns these companies. Again, WellMed and Optum, okay, it's owned by United Healthcare. Oak Street, it's owned by Aetna CVS. Village MD, it's owned by Cigna. Centerwell, it's owned by Humana, and then most of the other ones are owned by PE firms, and they're all designed to be able to provide care in a clinic basis or with providers that are incentive. And when I say providers, it's liable to be a nurse or a technician or a PA, and less so a doctor, but it's designed to limit access to care and to control care because there's fewer doctors and specialists to go around. So Medicare Advantage plan recommendations. If you're on, and I'll be in the recommendations I send to Medicare Advantage plan clients, I'm going to mention you're going to want to align yourself to those insurance company owned providers, maybe not in a year, but over the course of 2 years, or with an insurance company that is owned by a hospital and health system like a Baylor. And that's why you're less likely to be disrupted from contract disputes. There may not be any contract disputes this year, but it's going to happen. Whatever plan you have, there will be a contract dispute, because that can make the difference between profit and loss to an insurance company or a hospital health system. So my advice will be prepare, worry less about some of the ancillary benefits, which are being reduced. And ancillary, I mean dental, vision, hearing, and they're being reduced across the board because funding from Uncle Sam is being reduced. So the macro view here is there's going to be more disruption. So be prepared for it by aligning yourself one way or the other. And then if you're on a Medicare supplement plan, you have other doctor options than these JV or owned provider doctors and hospitals and clinics because you may be going to a doctor or a provider or a PA who is incentivized to limit access to health. Okay, Medicare updates. Now, here's what's happening to Medicare agents like me. This happened last year, and not that there ever has been very much compensation on a Part D plan, but there's no compensation on Part D plan. Then there's total elimination of compensation on Medicare Advantage plans in many states. Kentucky and Minnesota, the agents there, they're moaning and they're looking for, they've built a nice business, but many of those agents are, looking to do something else. In Texas, United Healthcare, Blue Cross, WellPoint, Anthem, now renamed as Elevance, and then Humana PPO plans. Their commissions are being eliminated as well. At the same time, there's higher level of agent certification regulation. I already mentioned I can't accept or request prescription information by email or text. I have to record every inbound and outbound call, and now every in and outbound call to my office line will be recorded, and I have to store it. I have to store those recordings for a minimum of 10 years. So I guess that means I'm going to live well into my 80s. And, there's just more certification requirements. As a result of this, if you call an insurance company or a call center, agent call center, a lot of agents, they're going to push you to the plan based on the plan that compensates them, not necessarily the one that is in your best interest. That can happen. I'm not going to say it will, but it can happen. I will tell you, though, that if you call an insurance company call center, they're not going to suggest you consider another plan or what's in your best interest. They're going to consider only those plans. So that's part of the strategy behind insurance companies doing this, is that they can control the conversation. And I've been an independent agent as kind of a lone wolf and always have. It's very difficult, but I've managed to stay ahead of this and to stay ahead of market changes by incorporating technology. Larger agencies that have a lot of overhead, they're having a tough time, and a lot of them aren't going to make it. And so the small and the big ones are going to have trouble. My approach in life, and this goes back to my childhood days and even my corporate career prior to becoming an insurance professional 23 years ago, my approach has never been to run away or run from challenges or complain about challenges, but run to those challenges because customers always come first. And just ethics and upbringing, I always want to do the right thing no matter what. Now, as a result of that, you're getting expertise, experience, advice, and support, both before and after enrollment. Enrollment's the easy part. Anybody can do that with a license. But providing that advice and support like this is really what matters most to you. And ethics and transparency are what matter most to me. And I hope you feel trust in the advice and the support you can get from me. So my goals for this year, I'm going to talk a little bit about me here for a second. I'm going to be asking clients to meet me halfway, but I'm always going to provide guidance. And I'm going to be educating clients throughout the year through webinars, newsletters. I now have a functioning website, and we'll be populating frequently asked questions so I can direct you to answers, and also through social media. I've never had the bandwidth to be able to use social media, but I now have that, and I'll introduce my team members here in a second. Also, I'm going to be reminding Medicare clients and ACA or Obamacare clients more often and requesting referrals and introductions. I can't make the first call, but here's the things that I truly believe in. I believe everybody should have insurance. Medicare, yeah, I can help people. I've got the bandwidth to support people and a support team and a continuity in my business and technology that I did not have before. Under 65, ACA, healthcare.gov, Obamacare plans, and also alternative plans. With what's going on in Congress, and don't get me started on politics. I don't believe in politics. I've pretty much tuned it out. Every politician is a grifter as far as I'm concerned. But the under 65 crowd, nothing is decided right now and probably won't be until open enrollment starts on November 1st. I'm also one of the top people in life insurance. Everybody, no matter how sick or healthy, there's a life insurance policy for you. And then short-term plans are another option that many people don't consider. But whether you're married or not, like me, there's not only medical expenses, but let's say you're released from surgery or you have an accident or a fall and you have a time where you cannot, maybe you need to bring somebody into the house for some hours each week to help with daily living stuff like cooking meals or laundry, you name it, or even a nurse. Short-term care plans can provide up to 6 months of coverage and provide a fixed benefit for that. And I have that too. So if you appreciate my expertise and support and are willing to leave a review or testimonial, I'll greatly appreciate it. Now, my goals through this open enrollment period for Medicare clients that begins October 15th is to provide you the complimentary Part D plan comparison and recommendations in October. And I'm committed to getting those out by the beginning of open enrollment that begins on the 15th or that first week. And then you'll be receiving a video on how to self-enroll beginning October 15th in a Part D drug plan. And that's for people on a Medicare supplement plan. And as long as you know the plan, you don't have to enter all your drugs and all that information. All you have to do, and you won't see this until October 15th, but all you'll have to do is log in or enter your Medicare number and then search for plans in your area and then click on the plan. And it should take about 5 minutes. Now, I've already talked about Medicare Advantage plan strategies, in addition to the plan recommendations and, the enrollment. You're also going to, I want you to know about upcoming changes so that, and this is no steering, this just lets you know what's happening because there's going to be continued change in this market. And I'll continue to provide advice to people that are turning 65 so they understand the difference between a Medicare supplement and a Medicare Advantage plan. 99% of the junk mail and spam you get as anybody on Medicare, or especially people that are turning 65 in the next year, it's all based on Medicare Advantage plans because that's where the profits are for the insurance companies and for related companies. Again, my goal has always been to run to the fire and not away from the fire. And this is my purpose, okay? And those of you that have been to Costa Rica understand the word pura vida, meaning pure life. And I'm blessed to be able to say that I do that. I visited Costa Rica for major dental work a year ago. And if you ever need significant amount of dental work, please reach out to me. I can recommend an awesome an awesome dental provider in Costa Rica, and it's a great way to save money and get a great vacation. But Pura Vida means pure life. Do what's important. Now, I'm going to introduce you to a couple of folks here. And let me see who's on this call here. So I'm going to stop the share. And then we're going to look for Claudia.
Hi, Mike. I think not either Wiley or I are co-hosts, so I don't know if you want to point us as co-hosts so you can
I
introduce.
just made you co-host.
And there are several questions in the chat, but
yeah, let me hold on one second, Clau. Let me introduce Claudia Ramirez. Claudia is a personal friend and wife of a very personal friend, and has been my back office support for the last, over a year. And she is now a licensed agent. And Claudia is fluent in English and Spanish, and she's a lot smarter and motivated to me. And I'm really happy that, and it gives me an opportunity to both mentor, but provide continuity in my business. And it's a great help. I talked about all the changes happening in the marketplace. Wherever there's change, there's opportunity. I've always believed that. Never run from the fire. Change is going to be constant in this business, and Claudia provides great support. Now, Claudia, can you make Wiley a co-host?
No, because we're not co-hosts, Mike.
Oh, okay. Well, hold on a second.
But maybe if Wiley speaks, I think she can be in the spot.
Sure.
Well, nice meeting you all.
Sorry.
I'll let you to Wiley.
Hello, my name is Wiley.
Hi, Wiley.
I'm part of the support team here in the Medicare Insurance Exchange, and I'm glad to assist you with your enrollments. And I'm glad also to be here with you.
There you are, and I'm going to unmute Claudia.
Hi, Mike. So you want me to read the questions that people have here?
Almost. Give me 1 second. Now,
Okay,
so we've got a support team. It's not just Mike poor Mike, too busy to answer. I have to introduce the rest of my team here. And I also want you to know that these people that share the same vision as to being here for you. And you can reach me. I now must record all calls and save them for 10 years. So I'll be around. They may outlast me, but hopefully not, the recordings. But all calls inbound, outbound calls must be recorded. You can call 214-764-6315. First English Spanish, because both Claudia and Wiley are both bilingual. I am not. Probably a dozen times a year, I get calls from people that are Hispanic, and English is not their first language. And, I answer the phone. Hi, this is Mike Chapman. How can I help you? And, they hang up, and that turns out to be somebody that I can't help. So Claudia, as a licensed agent, can help. Wiley can support. Now, Wiley's role, she is not an agent, but she can help. She is assisting Claudia and me quite well. She's doing a great job, and she cannot enroll, but she can enter information into secure forms. And there's a secure form for both Medicare, for Obamacare, ACA plans, and also for life insurance. So if you can't reach, the best thing to do is for your stake in terms of time, is to complete the form. But I do have some clients that maybe they don't have access to, or haven't haven't had a computer that works for some time or a tablet that works, well, Wiley is here to answer calls and also to support us and to direct messages for us, because we're going to be nose down with plan recommendations and support and proposals, recommendations for, really till the end of the year. Now, you can reach Wiley at 214-764-6315. You'll be asked for English and Spanish, and then extension 3. Claudia's extension 214-764-6315, extension 2, and mine's extension 1. Those of you who have friends or relatives that are English as a second language and now have the ability to support that. And that's 40% of the market in Texas, Georgia, Florida, and other Illinois, and Chicago, and other Colorado. So now they have the ability to help more clients. So Claudia, why don't you go ahead and let me know what the questions are in the chat.
So I posted in the chat the phone number and the extensions, so you want to get them from there. And I also posted the Medicare survey for those of you that haven't completed your survey yet. I'm seeing a lot of names, and I know we already have your survey, so thank you for helping us help you. So there's a Medicare survey there in case you hadn't completed. If you already complete the survey, you don't need to do it again. And there's the ACA survey also, and the life insurance survey in case you want a life insurance option. And some of the questions that they asked, Mike, it's one of the questions was, what is considered to be healthy?
Well, healthy is in your own mind, and that varies by age. But I can tell you, that probably has to do with underwriting. From an underwriting's perspective, you complete a form. You're not going to have to do a physical, but you're going to have questions like, do you have any of these conditions? Any back pain? That's a big one. Recent surgeries within the past 5 years. Whole list of medications. You have to provide HIPAA access to both your health and your prescription information. So, prescriptions can be a no-no or automatic rejection. We pretty much know what those are, and each company has a different list. So, if you're on the border, you're not sure, and you're wanting to consider a different Medicare supplement plan, then just send me an email to mtchapman@medicalinsurancexchange.com and fill out the life insurance link. And then, I'll be able to, assuming we've been related as far as agent-client relationship, I have a pretty good understanding of my clients' medical conditions, maybe not necessarily most recent since last year of prescriptions. We'll have a conversation. And then, no matter how, that's on the health, changing from a Plan F or Plan G to a Medicare supplement Plan N, or more likely a high deductible Plan G. You can cut your premiums in half if you're looking at changing from F or G. But I would also recommend for if you're going to do that, and also for Medicare Advantage plan recipients to consider a low-cost hospital confinement plan, because it's the big stuff you have to worry about, and sooner or later we all encounter big stuff that costs money.
Okay, someone, Dwight put, Texas Oncology told me if I change from my Plan G to Baylor Scott and White Advantage, I should get the PPO rather than the HMO. Can you guess why they'll tell me that?
Well, it would, Texas Oncology is very closely aligned with Baylor. Many of the Baylor facilities have Texas Oncology clinics within them, the hospitals, and it's an excellent group. They can, you have to know that they're looking at it from their perspective. But from your perspective, and whether you go to an in-network doctor or an out-of-network doctor with a PPO plan, the PPO, a Medicare Advantage PPO plan, yeah, you may be able to see more providers, but it also increases your out-of-pocket medical expense risk. In network, it about doubles. So you're taking on a whole lot more medical expense risk with a PPO plan, whether or not all of your doctors are related to Baylor. So we'll go through that when we go through the recommendations and we have a chance to review and discuss. Great question.
Another question, do supplement clients also get recommendation email, or is the supplement more stable?
Yes, Medicare supplements are more stable. You don't have to re-enroll. You could consider changing plans if you want to, and you think you're going to pass underwriting guidelines. But the benefit of a Medicare supplement plan is that you can see any doctor anywhere in the country. You couldn't with a Medicare Advantage plan go to MD Anderson if you live in Dallas. And there's hundreds of other examples like that. So Medicare supplements, most people did not encounter those or were not made aware of them when they turned 65. About 60% of the market across the country are Medicare Advantage clients.
Well, that's all the questions I have. I don't know if anyone else wants to ask a question to Mike directly.
Okay, I was the one asking about the supplement plan.
Yeah.
I was thinking in terms of, the medical coverage, be it Humana, Aetna, whomever. I mean, is that still stable or is that changes?
Yeah, it's very stable. The benefits, the coverage in Medicare supplement plans, there are controlled by Center for Medicare Services, and the medical coverage, there's no different from one company to the next. What varies is what you pay in premiums and how fast those premiums go up in age. Now, this recording will be sent out Monday. I'm editing it so that you will have the links in the recording and some follow-up reminders. And you'll also get those who have not completed the secure encrypted link. I'm going to send that in the email along with the link for the previous month's or the previous week's recording. My next step, and believe me, this is a labor of love. This is complimentary. There is no compensation on my part, but I'm, the three of us are working full time on behalf of every Medicare supplement and every Medicare Advantage plan client to prepare over 1,000 recommendations and plan comparisons. And my goal is to get all of these to everybody by October 20th. I'll be setting enrollment appointments with Medicare Advantage plan clients for open enrollment in October. During November, I have to shift my emphasis to my comparably sized Obamacare clients, and their world is being rocked. Nothing's been decided. But there are many things that people can do now to prepare for open enrollment beginning November 1st. And as more information is updated as to what the rules and regulations are, I'll be sharing that with people on a week. And I bring this up because you may know people, or you may have a spouse who is not yet 65 that is relying upon these plans for coverage. I'll also cover alternative plans. Now, my goal is to get the recommendations to Obamacare clients by November 15th, which is not the first day of open enrollment for them. Now, my personal goals is to continue to improve on my health and longevity. And, I build up either through personal experience or through learning. I'm a continuous learner about chronic conditions, diabetes, cancer, heart attack, and stroke, dementia. Many of you know or have a spouse that deal with dementia. And, I have, my father went through that. It's a tough way of going. That leads to long and short-term care options, both in the home and away from home. And then end of life, not just insurance, but things like, how do you prepare for end of life? Do you have a power of attorney, medical power of attorney, in hospital, out of hospital power of attorney? And do you have a do not resuscitate DNR? And does your hospital have a DNR? If you have a DNR, then be sure and post a copy of it on your refrigerator door. That's the first place an EMS looks, is to see if there is a DNR. And so this is my purpose. I'm sharing my personal and my professional experience, and I hope you benefit from this. And as always, I run to the fire, not away from the fire. This is my purpose. And, I live a pure life, and I am grateful for everything that, all the bumps and bruises and all the experiences that I've had through my life, and how I've learned and stayed steady to my path. Now, I'm going to share these again. These are the links to the secure and encrypted forms, and I'm going to leave this up for a second. And you can pause the recording so you can either use the QR code or copy that long link to for Medicare clients for both Medicare Advantage. I'll need both prescription and doctor information, first and last name. Prescriptions for Medicare Advantage plans, and for Part D plans, I need the name, dosage, and frequency of the medications, which you'll fill in by completing the form. And please share this link with friends, families, and neighbors, or the QR code if they use that, so that they can benefit from this too. Now, for ACA or Obamacare plans, there's a different link. And again, the rules won't change, but I cannot wait until November to be preparing things, so that I'm asking, again, several hundred clients to complete these forms now, so that when open enrollment and the rules have been decided upon, they will have already completed the first steps, and they'll be prepared for open enrollment. Please share this. And then finally, if you're there's a life insurance plan for everybody. If you have need for life insurance, no matter how sick or healthy you are, I can support you with that. Now, here's what to do if you have problems filling out that form. First of all, there was a recent iOS update to Safari that has made it virtually impossible to open it from an iPhone, iPad, or Mac. So use Chrome, Microsoft Edge, or Firefox, and turn off any ad or pop-up blockers, and try it again. Now, if you have problems still opening the links, here's some other things to do. You can call this extension 4, and have the Medicare form texted to you, or extension 5 and have the Obamacare form texted to your cell phone, or finally extension 6 to have the link for the life insurance form texted to you. And then what you want to do is copy that link and send it to yourself or your spouse from your email to your email address, and complete the form from a computer or laptop. It's difficult to do from a phone, and especially an iPhone. And please do not email me this information. It's a big security risk, and it slows us down because we have to enter that information ourselves. And, every minute counts between now and the end of November. Also, please don't call just to ask questions or ask when you're going to receive your recommendations. I'm available on Fridays from 11 to 2 for Medicare clients during October. And please limit questions to these times so we can get some work done. And except for special circumstances, Part D clients must self-enroll at Medicare.gov beginning October 15th, and only if the recommendation shows that there is a better plan, or if they want to change their Part D plan. So I'll be setting up appointments with all clients, or those who want to consider a Medicare Advantage plan for next year. and they'll receive an email to set up a time to review the recommendations based on their doctors and their meds and the available plans, which have all changed, and the pluses and minuses versus a Medicare supplement plan. So again, be sure to check your spam folder because the recommendations may go to spam, and the email will come from MT Chapman at the MedicalInsuranceExchange.com. If it ends up in spam, please put it in your inbox so the next one doesn't go there. And limit calls, please, during office hours on Friday from 11 to 2 during October. And I don't mind telling you, there's over 1,000 of these to generate and recommendations. And, there's 2 other people that are working full time for me, as well as myself working about 120 hours. And it's still going to be difficult to get these out by October 15th or thereabouts. And please watch these recordings before calling. It's difficult to, a lot of the questions can be answered if you would take the time to watch these recordings. Now, standalone Part D plans, which is what you have if you have a Medicare supplement plan. Again, except for special circumstances, Part D clients must self-enroll at Medicare.gov beginning October 15th. And only if they want to change plans. So if you get an email from me that says you're on the best plan, don't do anything based on your medication information, then great, you won't have to do a thing. You'll also, for those that do want to change, you'll get a short instructional video. Was in a longer video during the first week, but there will be a shorter one to show you how to self-enroll at Medicare.gov. You can also call 1-800-MEDICARE to self-enroll, but it will obviously take longer. You will need your Medicare number, and if you have an account at Medicare.gov, great, but you can also enroll with your Medicare number, your ID number. And again, only Medicare Advantage clients or those who want to consider one will get an email that will request setting up a time to review and enroll. And please limit all others limit calls to Fridays during October, 11 to 2 p.m. And thank you again, office hours for this information. And now
Rebecca, you can also dial extension 4 and you can get the link directly. I already pasted the link again. I don't know if you can go to it after what Mike said, like the optics and everything. And then you can also erase cookies, and that will help you a little bit to complete the survey. And there's another question, Mike. What is the difference between supplement F and supplement G?
Okay, sure. Great question. All right. Those of us that were born in 1954 or earlier, you could and may have enrolled in a Plan F. A Plan F has no deductible. The plan covers everything. All right. All medical expenses. You still need a Part D drug plan for prescriptions, but a Plan F covers basically no, you can still see any doctor anywhere in the country with either Plan F. A Plan G, there is a deductible that you must meet every year. That deductible is the Part D Medicare supplement plan, deductible, which, and again, you buy Part B from Uncle Sam. This year, that deductible is like $260. You meet that deductible, and that's it for the year. So, like the first time you see a doctor, maybe the second, you met the deductible. Everything else is covered for the year. That ends up with much lower premiums, not only because that deductible, but also because younger people coming into it, it's a matter of claims. Younger people are enrolling in that plan, and so it tends to have less inflation than a Plan F. People on Plan F, we're in our mid-70s, we have higher claims, but also there aren't younger people coming in to reduce for the premiums to cover the claims. But you can still see any doctor anywhere in the country with any Medicare supplement plan. So it's not just the difference in premiums and deductible, it's also having access to any doctor and hospital in the country that accepts Medicare. And 95% of all doctors, like 99% of all hospitals, accept Medicare at this point.
Is there any other question? Will you be sending us recommendations about any changes we need to make? Yes.
Yeah, and Deborah, I have your form. Thanks for doing that. And anybody that has had difficulties, just reach out to us. Everybody will get a plan recommendation and comparison, so you know what's going on. Whether it's a Part D plan, where I'm going to ask you to self-enroll and give you guidance on how to do that. It should only take about 5 minutes at Medicare.gov. Medicare Advantage plans, it's a little more complicated with that, and that is due to you're dealing with which doctors and which network, and that may have changed from the past year. What's liable to happen not only next year or in the year beyond, and how to best align yourself with those changes.
Any other questions?
All right, now a couple of things. First of all, I'm going to be around until 2 p.m. You may not want to show up on a webinar like this, or you may want to discuss something privately. So, call me at 214-764-6315, extension 1, if you have personal questions. I'll be around today till 2, and also Friday from about probably 12:30 to 2, because I'll be having the first ACA client webinar either Friday or Tuesday or Wednesday next week, but I'll be available during those hours next week. If you call me, and this is the hardest, this is a very hard habit to break. If you call me during the day, because of needing to really bear down now on sending out plan comparisons and recommendations, my phone, you will probably hit my voicemail, because I get somewhere about 100 calls a day during the first week of open enrollment, and I don't get anything done. So I'm trying to break that habit, at least until open enrollment ends sometime in January, so that I can focus on this, help as many of you as possible, and give you good guidance for what to do. But I will get back to every caller. All right. Well, hey, thanks a lot. We had a good turnout, and I know there are a lot of people that emailed me that said they couldn't get on, or they couldn't, they couldn't make it for one reason or other. You'll have the benefit. The first webinar was not up to my standards. This last week's was pretty good. I think I covered things that I could cover today, that I couldn't last week because of the blackout period. But be assured that as long as I have your information, you'll be getting plan comparisons, recommendations, and guidance on what I feel you should do. Thanks again. I'm going to cut it off, and feel free to call. Thank you. Bye-bye.
Bye.
Bye.
Thanks so much. Sure appreciate it.
Thank you.
Thank
Look forward to
you.
hearing from you.
You too.
Thank you.
Yes, thank you a lot for your help.
You bet. Thanks a lot. Thanks for showing up.
Thank you, Mike.
Appreciate it. So with that, pura vida, everybody, and thank you. Thank you for allowing me this amount of time with you to share my purpose and how I can serve you and your friends and your families and your neighbors. Look forward to talking to you 11 to 2 p.m. on Friday, and advise and support and enroll you where possible. Thanks very much. Have a great day and a blessed fourth quarter 2025 and 2026.